We hear a lot these days about off-label uses of prescription drugs. Of course, that's when a medicine is used to treat a condition not intended by the drug maker. It's a fancy term for freelancing, and often it's done out of sheer desperation. That's what drove a young woman in Australia to use Ambien to treat her fiancé. Of course, millions of people take Ambien to go to sleep, but in this case, it had the opposite effect. And as Sarah James reports, it provided proof, at least to this one family, that deep inside a coma, their loved one was fighting to say, "I'm here."
Not only that.
Sam Goddard of Brisbane, Australia, was about as alive can be.
Oh, well timed with that get-up, Sammy.
A guy who could do nearly anything.
Oh, that was sick.
That is, until Valentine's Day 2010, just 3 months before his wedding. On that day, Sam was playing a friendly game of soccer. He suddenly got a headache so severe that he had to be rushed to the hospital. He had suffered massive strokes, 8 of them. Doctors told his future wife, Sally Nielsen, that Sam most likely would never recover.
They said he'd be a vegetable.
Did they use the words being a vegetable?
They did. There was actually a doctor that told us that we would be better off letting Sam contract an infection, put him in a home, and just let him die.
He was in a coma and on life support. Doctors couldn't figure out why Sam, just 23, had suffered so many strokes. But the doctors did know that Sam had catastrophic brain damage.
They said he'd just be in a wheelchair, that he'd need to be in a home. They really had no hope for him.
Doctors told Sally he most likely had the mental capacity of a young child. Unable to speak, he could only moan. That's when Sally started scouring the internet and made a remarkable discovery, a treatment that didn't seem to make sense. She read stories of how Ambien, the sleeping pill, seemed to actually wake up some brain-damaged patients.
I found a video of a family overseas who had used it for their son, and he had gone from a vegetative state to someone who was able to eat, and it just blew my mind, and I felt like Sam had to have this drug.
But Sam's doctors refused to give it to him. There was no proof, they said, it helped brain-damaged patients.
They almost laughed at us, really. They didn't think it was possible that a sleeping tablet could awaken someone.
You were willing to roll the dice.
Definitely. I felt compelled to.
So Sally told doctors Sam needed Ambien to sleep.
You kind of gave a little fib.
Yeah, definitely.
Big fat lie, actually.
A huge big fat lie.
So what did you think the Ambien might do?
I thought that it would stop the moaning or give him a little bit more of a functioning body.
But when she gave him a pill, nothing happened. So on the 5th day, Sally took a chance and on her own increased his dose by 50%. That afternoon, Sam's parents were home and saw they'd missed a phone call and a voice message.
And there was Sam saying, "Dad, I'm talking. I'm sorry, I don't get emotional. But this one was it was just unbelievable.
Hey, Dad, I'm talking.
Hey, Dad, I'm talking.
The man written off by doctors as a vegetable was speaking, and after 15 months in the hospital, he came home.
Hello, Sarah.
Hi, Sam. It's great to hear you talk.
It's great to be talking.
His speech is slurred, but he no longer is trapped in his body. Turns out his mind was always working, he just couldn't let anyone know. And Sally, who always believed Sam was in there, now had the proof.
I understand you're good at math. What's 30 plus 70? What's 20 times 30?
Ambien turned out to be their miracle drug. Sam can now communicate his needs, his desires, and his feelings for Sally.
What did you feel like doing when you realized that you could talk?
You felt like shouting from the rooftops.
Do it. That's the best part about the Ambien, is that it shows people that what I believed was true, he really is in there. Which arm should we put in first?
Sam's speech is better some days than others. But now that he can ask questions, he must also cope with some tough answers.
It was hard.
Pretty tough, mate.
We nearly lost you.
We nearly lost you. We wanted you to get better.
Because you were in a coma for a long time and in the ICU for a long time. Hey? And look at you, you're doing so well. It's alright. It's alright. Just breathe.
Also difficult is the cruel twist to this use of Ambien. The effects of each dose last only an hour or less.
It's very difficult to comprehend the fact that I can talk now. And in an hour or so I won't be able to talk at all. It sucks. It really sucks.
We could see the drug start to lose its effectiveness during our interview.
Yeah, it's wearing off.
How can you tell that it's wearing off?
The expression in his face starts to go, and his tongue doesn't move as much inside his mouth.
Trying to prolong his speech, Sally gives Sam Ambien 4 times a day. But she's guessing it's the right dose because she can't find a doctor to advise her.
There's no one in Australia that's willing to help us, so we're very much winging it.
Here in the United States, an estimated 1.7 million Americans suffer traumatic brain injuries every year. But we could find only one U.S. study trying to unlock the potential of Ambien to treat them.
We're not yet able to advise families on how to use this drug clinically because the research is in the very early stages.
At Philadelphia's Moss Rehabilitation Research Institute, Dr. John White is using a government grant to study Ambien and brain injuries. What scientists know now, he says, is that Ambien's active ingredient, zolpidem, is the trigger.
The red-colored images here are pictures of the amount of blood flow in the brain at rest. In this row, the patient is off zolpidem, but in this row, the images were taken after a dose of zolpidem. The yellow is more blood flow. You can see that blood flow has increased in several areas, particularly areas involved with language comprehension. Look in the mirror.
Dr. White cautions that his preliminary research shows that fewer than 10% of brain-injured patients even respond to Ambien, very few as dramatically as Sam. Also, he says, if you give a patient the drug several times a day, each dose may not last as long.
I reckon you should sing him.
So for now, Sam and Sally are on their own. They still have plans to marry one day, and Sally says she's just happy she never gave up.
A lot of people expected me to walk away, but they just didn't realize that our connection is unbroken. It's stronger than anything I've ever known before. So I couldn't do that.
Why not?
I wouldn't be me. Without him, I'd be heartbroken.
And without Sally, Sam says, no one might have believed he always was in there, especially during that painful year and a half in the hospital when doctors said he was a vegetable.
Could you hear people talking about you? That must have been hard. What did you want to tell them?
Sam and Sally sent us a video update recently to show how his recovery is progressing, and you can see it on our website, rockcenternbc.com.